Well, Dr. Bruce is with us today with the results of a new study, and you're telling me that in order to decrease my risk of stroke and increase my heart health by that 10%, I need to get out, and you say it all the time, and get out and exercise.
Yeah, and let's define exercise now. We're
Yes,
talking
we did.
about 30 minutes, brisk walk, six
times a week.
Okay. Or bicycling.
Right.
And if you want, you can do the gym type bicycle, or
Stationary
you
bike.
can even do the prone bike.
Does it count when I read my magazine on the mic?
No, it counts, yeah.
Okay, good.
There's extra calories in turning the pages.
Excellent.
Which is very good. But the main thing is, in people as we get slightly older, and especially women, there is a tendency for the top of the heart to begin to flutter. It's called atrial fibrillation.
Right.
And when it does that, blood wells up and it clots.
Sure.
And then you get a clot and a stroke. And that's a real concern. So the common treatment is to put you on a blood thinner so that it doesn't go and stroke. But the problem is that the blood thinners have their own side effects, quite severe, and a lot of people just don't want to be taking medication. Now, there are beta blockers which will lower your heart rate, but what this study showed is that women or men who would just work out 30 minutes, brisk walk, a little cycling, cut their risk of this happening by 10 to 15%. Now that's a huge decrease, and it means no meds.
Right, but not only does it mean a decrease, a 10% decrease in this happening, it also means there is a marked decrease in the risk of stroke.
100%. And that's, it's really interesting because it very much, some of my older patients will come in and they'll say, I don't like this medicine, I don't like the fib, but is there anything I can do? Well, this study says, yeah, if you just get up and walk. Now, senior citizens, myself included, it's not easy to get out and do 30 minutes of brisk walk.
Sure.
I mean, I got 100 things I need to do and so on. But if you just put that on your calendar and do it every day, it looks really exciting. And this is an 11-year study, so it's not like it was overnight. I mean, it takes time.
Well, very quickly, when you say brisk walk, do we have a heart rate we're targeting for when we do this?
Well, that's a good question. A lot of people are on medication for blood pressure that lowers your pulse.
Right.
No matter what you do, your pulse isn't going to go up.
Sure.
So to me, it's deep breathing. When you begin to feel like you need to breathe and you need to increase your respirations, that's where you want to be.
All right.
All right. And generally what I say as a brisk walk means, instead of just
Shuffling?
Yeah, shuffling is, you saw me shuffle in, but walk briskly.
All right, great advice, but don't immediately stop your meds. Of course, talk to your doctor before you do
please.
any of this.
The meds are still critical, but if we could begin to cut back on that, and there are new meds, but I think the main thing is now, it just reemphasizes, we don't have to do a lot.
Just get active.
Just get active.
All right.